Hey everyone, my name is Shane Wyan, and today we'll be talking about medical advancements and how they have changed society. This is for the University of Maryland Global Campus, Technology and Contemporary Society. My guests today are Dr. Zachary Lubline, General Medical Officer, U.S. Navy, and my wife, Xuan Chang, RN, BSN. Hey guys, how are we doing today?
Doing great. Thanks for having me.
Yeah, thanks for having me on your podcast for your final project.
So, the first thing I want to talk about with you guys is this interesting article I found called Critical Care. This is by Dr. Fleming Phelan. He's an MD, and he published this article in the McGill's Medical Guide. This is the online edition, 2022. Dr. Fleming kind of like describes critical care as the branch of medicine that provides immediate services, usually on an emergency basis. Now, like, what I really want to get from you guys is how do you think the existence of ICUs, these intensive care units, have affected our society? I'll start with you, Dr. LeBlanc.
Sure. So, an ICU is really just an extension of all the other kind of medical care that we have, but to the most serious illnesses, right? And so, what I think you're getting at is that, like, at one point in humanity's, history of medicine, the people experiencing ICU level issues would just die, and so somebody who came in with really bad heart failure, somebody who came in with kidney damage, somebody who came in with advanced trauma, they were generally triaged as somebody who just wasn't going to make it. But as we developed a little bit better ways to deal with those kinds of situations, put people on ventilators, give them support for heart and kidney conditions, care for neurological damage. As we created those things, we were able to develop a way to treat issues that in the past we hadn't been able to. And so now there probably is a growing understanding within societies that a person can suffer certain issues, certain damage to their body, and be supported enough to be able to rehabilitate. That being said, I also think that a lot of people still fear the kind of process that they would have to go through to be in the ICU. And so I don't know if we've completely gotten away from the kind of things that would make it disadvantageous, the kind of things that would make somebody feel cautious to get hurt, And that goes for traumas, it goes for taking too many risks on your day-to-day life, but I think it also goes to a certain extent for the more chronic conditions that might also put somebody in the ICU. People don't want to be on a ventilator. So if they get told this might happen, so you might end up on a ventilator, in all likelihood, they're going to feel like that's something they still want to avoid. And so until we get to the point where being in an ICU is even better than what it is now, even faster, even quicker recovery, less pain, until we get to that point, I don't really know if we're going to see huge dramatic changes in how society views their kind of risk adversity in making decisions.
Yeah, and that's a great point. And that actually goes into kind of like what I want to ask Nurse Shani is, do you think with these new inventions, these new improvements to the ICUs, that after a patient comes into an emergency room, they stabilize, they get sent to an ICU, and then they even get sent almost back to 100%, or at least close to. Do you think this kind of lowers the psychological fear of death, or may it do that in the future, you think?
I definitely think it helps in a sense to lower that fear, but like Dr. Lubline said, I don't think it, like, what's a good word, erases all of that fear. I think people are still going to be scared. Like, you see all these families, like, even with COVID just recently, like, people were getting sick, people were going to ICU, people were dying. Like, even now, regardless whether it's COVID, something else, like a car crash, people are going to the ICU, and sometimes that fear of, I don't know if they're going to come out, I don't know if I'm going to survive, like, it still exists. Comparatively to before ICUs and all this medical advancements, I definitely think people have a higher chance of surviving. So again, They might be a little less afraid, yes, but I think that fear and risk is still there.
And this actually segues perfectly into my next topic, which is going to be regarding to kind of saving lives on the battlefield. We talked about civilian kind of emergency care and going up from the ICU. But what happens the psychological fear of death for our troops on the battlefield, right? There's this amazing article called "Saving Lives on the Future Battlefield: Medical Advancements Help Prepare Force for Deadlier Fights." This was written by senior staff writer Gina Cavallero in the Army Magazine 2020. The big thing I want to take from this article, though, is there's this new device that they're starting to bring up called the CROSS, CROSS. That's Combat Resuscitation Organ Support System. This is a nice little vest that you wear that provides all sorts of different things like breathing support, circulation support, delivery of blood, delivery of medications and fluids, has a lower chance of infections, and it even has a kidney function module for giving prolonged continual care on the battlefield. They call it an ICU in a vest. Now, I'm a Navy hospital corpsman, and I specialize, especially being with the Marine Corps side of the Navy, a lot with combat care and combat trauma. And for me personally, I think this is going to revolutionize. If we get it to a point where it's affordable and accessible to all of our military members, I think this is something that could revolutionize combat medicine as a whole, and definitely decrease that psychological fear of death. Now, this isn't something that can only be used in the battlefield. They even specify in the article this can also cross into civilian sector for paramedic and emergency medicine. And I just want to ask Nurse Shani, do you think this is something you'd look forward to? Do you think this is something that could affect society if it were to hit the civilian sector?
Um, yeah, I definitely think it would affect society, but in a positive way. Saving lives, making sure people survive traumatic incidents is always a plus, especially as a healthcare provider. It's going to be great to see this used in a first responder kind of setting in the civilian world. But yeah, I definitely think it'll be a while before we can affect or implement this in a broad setting where it's kind of worldwide or even nationwide, just starting in America or wherever it was developed in terms of finding those resources. But I think it would be great to see that.
Now, in a hypothetical world where this is highly accessible and everyone's wearing it, how do you think this would affect our future society, Dr. Lubline?
I think we're still going to have situations where this kind of care saves somebody's life, but with some costs. And so somebody is still going to have certain things that they're not willing to take the risk in doing. And certain kinds of trauma, certain kinds of illness that they don't want to go through. Nobody likes to see their loved one die, but nobody also likes to see their loved one suffer, be in pain, be ill. And the kind of treatments we're talking about are life-saving, but they're not convenient. And in a society that really does seem to kind of put a gold standard at like convenience and pleasure, these are going to be the kinds of things that give us a safety net, but I don't think they're going to be the kinds of things that make us hope for a bad outcome for something. And I still think we're going to have that as a little bit of a little hang around in the back of our mind when people are thinking about the risk of doing certain actions, making certain decisions about their health.
Now, my next article I want to talk about, this one is actually a fascinating article. And for any viewers out there, anyone listening, if you haven't read this article, I highly recommend it. It's called "The Quality of Care in Abortion in the Era of Technological and Medical Advancements and Self-Care." Now, this is written by Shoklia et al., 2022. Now, I have a lot of things to take away from this article. And my first one that I really want to tackle here is in this article, they mention a lot about the increased quality of medical abortions around the world. This is leading to better access to self-use medical abortion medications. And my biggest question, especially for you, Dr. Lubline, is how do you think this will end up ultimately changing our society going forward?
Well, all of the data on any form of contraception throughout the world shows that provision of contraception to female populations leads to the country, the community, the group that they're looking at rising up. It leads to women being able to make decisions about their lives, about how many children to have, about when to have children. And that goes for any form of contraception, but it also obviously applies to abortion. So being able to put that power in the hands of women and in the hands of doctors is going to allow a lot of choice for those women in their lives that they previously didn't have.
Thank you. And my next kind of thing I wanted to take away from this article is they mentioned high reliance on telemedicine. This has increased especially since the start of COVID, which has started to kind of turn our point of care from being at the doctor's office to being at home. Now, Nurse Shani, I want to ask you, how will you think this will shape our world moving forward? Do you think we're gonna really lean into this telemedicine, making the home the point of care, or do you think we're going to kind of revert back to doctors' offices once COVID fully relinquishes?
I personally think there's going to be kind of like a tug of war between the two. I like that there is a shift toward telemedicine, but I do still like the accessibility of being able to go into a clinic. Um, Moving forward in society, uh, I think that will continue in terms of people will want to do one or the other. They would want the convenience of seeing a doctor at home through their mobile device or a laptop, etc. But in other cases, depending on the situation, I'm sure they would love to be seen in person. I know I myself, as a patient, I love being able to call my doctor and sending a message and saying, "Hey, what's wrong with me?" But at the same time, I also want that kind of in-person interaction and being able to see my doctor and talk to them in a room.
Yeah, and that leads in right to my next question, which is kind of like the increased access to care, especially on these websites now, www.womanonweb.org. You can find things like self-administered medical abortion medications, and it's crazy to me to see the access to these medications increase even in places where medical abortions are illegal. Dr. Lubline, what do you expect from this?
I expect that we're going to still have an uphill battle, but that as women's healthcare becomes more available to women without having to go through what are a lot of barriers within a still patriarchal society, then we're going to see them able to make decisions for themselves on how their healthcare is going to work. And in places where there are more barriers to women taking charge of their health, it becomes all the more important for us to have these avenues like telehealth, like websites, sometimes like being able to interact with a healthcare system in a different state or a different country, and being able to get access to the things that they need in order to continue living the lifestyle and the level of health that they desire.
My last topic is going to go into assisted reproductive technologies, also known as ART. There's my last article I kind of want to bring up to you guys here is the history and future trends of ART, medicine and law. This is by Crocken et al., and this is in the Family Court Review Journal, 2021. Now, there's a quote I want to say from this, and in this article, they even mention a demographic. There's 8 million childbirths from assisted reproductive technologies. Now, with this increased fertility progression with ART, with IVF, with medications like Clomid, etc., I really want to ask you guys, and I can start with you, Nurse Shani. History has shown that the current rate of scientific discoveries can outpace any laws fixed around limiting medical possibilities. Do you think reproductive rights and limits will have to eventually be re-examined?
Um, Off the top of my head, I would answer yes. I couldn't tell you specific medical policies right now regarding reproductive law, but can definitely see society leaning that way and having to kind of backtrack and see what we've done and see where we're going, especially with the way fertility clinics and all these kinds of treatments are used. Um, I know I personally have noticed like different countries have different parameters in terms of how many times you can take a certain medication, like Clomid. Like in the United States, they limit you to X number of cycles. And then you go to the other side of the world, and in other countries, they're like, oh, we can kind of push that a little bit because they have different safety parameters, they have different studies going on. And I definitely think it's going to be a worldwide issue where we need to just communicate all of that research and kind of find that middle ground and understand why are we doing something versus someone else doing something else, and kind of figuring out the best way to move forward and helping people with fertility issues.
Yeah, for sure. And this kind of goes into my last kind of question. Dr. Lubline, what do you think our future will look like? And this is it coming from the perspective of, we have prolonged life from increased medical advancements, and now we're having increased fertility with births happening at an increased rate. What do you think our future is going to look like in maybe 50, 100, 200 years and on?
Well, the upside is that in a lot of places, birth rate is not necessarily rising exponentially or getting out of control as the healthcare options increase. If anything, the birth rate, due to what we've already discussed, forms of contraception, empowerment of women, all that kind of stuff, is decreasing in a lot of places. But what is increasing is the ability for people to take charge of their reproduction, meaning that they can have babies later in life. They can have, babies who are twins at times because they've chosen that they want, twins through in vitro fertilization, things like that. And so the ability to control more and more about reproduction, it comes with a lot of different like down the road questions. But for right now, it's allowing people to experience something that they otherwise wouldn't have been able to at times experience it later in life than they thought they were, going to be able to, but to still become mothers, fathers, parents when they want to. And I think that's a great change. Thus far, it has not come with any risk to overpopulation. It has, if anything, occurred at the same time that birth rates have leveled out in places that are developed and where healthcare has stabilized.
So that's a great response. I want to thank you guys so much. We covered a lot of topics today, starting with Dr. Fleming Phelan's critical care article. We also discussed a little bit about the cross device and how it will affect our future society. We also went into medical abortions and telemedicine and access to care and how this will come to affect our society. Lastly, assisted reproductive technologies. We discussed reproductive health and the improvements it'll make towards our society in the future. Thank you all for listening. I hope you have a great rest of your day. I want to thank both of you for coming here. And where can they find you?
They can.